Welcome to The Explainer. Today we're diving into a really common men's health issue, an enlarged prostate, or what's known as BPH. We're going to break down some source material that looks at what it is and a potential way to deal with it that doesn't involve surgery. All right, so here's our game plan for this explainer. We're going to start by really getting a grip on the problem itself. Then we'll check out the standard treatments and some of the alternatives. And finally, we'll zoom in on a specific supplement called ProstaVive and see what the source material has to say about it. Okay, let's get into section 1. Before we can even begin to talk about solutions, we have to understand the problem, right? So what in the world is BPH? And what does it actually mean for someone's day-to-day life? So the source keeps the definition pretty simple. BPH is when the prostate gets bigger, but it isn't cancer. The real issue, as you can kind of see from the diagram, is all about location, location, location. As that prostate gland grows, it puts a squeeze on the urethra, which creates what the source calls a plumbing problem, and that leads to a whole cascade of other issues. So what does that plumbing problem actually feel like? Well, the source lays out a bunch of the classic signs, things like a weak stream or that nagging feeling that you haven't quite emptied your bladder. And of course, that constant, urgent need to go that can just mess with everything, from your workday to a good night's sleep. Now, this is where it gets really interesting. This slide shows how a clinical term translates into a real-life problem. Urinary frequency isn't just a medical phrase. It's something that completely disrupts your day. Nocturia isn't just about waking up. It's a direct assault on your sleep quality. This is the point where a health condition stops being abstract and starts affecting your quality of life in a major way. Okay, let's move on to section 2. Now we're going to look at how the source material frames the usual medical treatments for BPH, and maybe more importantly, the potential downsides it highlights. According to the document we're looking at, the conventional path usually splits into 2 lanes. In one lane, you've got medications. Some are designed to relax the muscles to help with flow, while others actually try to shrink the prostate itself. The other lane? That's surgery, where tissue is physically removed to open things up. But, and this is a big but, the document quickly pivots to what it sees as the potential drawbacks. It points out that medications can have side effects like dizziness or issues with sexual function, and surgery, while like any invasive procedure, it comes with its own set of risks: infection, bleeding, you name it. This whole section is really setting the stage for why someone might start looking for another way. And that brings us perfectly to section 3, which is really the heart of the source materials argument. Let's explore natural alternatives. This is where the whole story shifts from the problems with standard treatments to a different kind of proposed solution. The foundation of this natural approach, as it's laid out here, really boils down to lifestyle. The document pushes for a kind of holistic strategy, focusing on a healthy diet, staying active, and managing stress, suggesting that all 3 of these things can play a part in supporting your prostate health. This slide does a fantastic job of showing the next layer of this natural idea. The source points to specific plant-based compounds and basically sorts them into 2 camps based on how they're supposed to work. You've got ingredients like saw palmetto, which are framed as DHT blockers to target that hormone tied to prostate growth. And then you have others like stinging nettle root, which are said to help with inflammation. And now we've arrived at the main event, the real focal point of this whole document, the ProstaVive solution. After laying the groundwork with lifestyle changes and natural compounds, the source introduces a specific product that claims to wrap all those ideas into one simple supplement. So ProstaVive is put forward as this comprehensive formula, and the source makes a special point of calling out its 2025 version as a big breakthrough. The main claim here is that it's the result of a lot of research, all designed to offer a complete, natural way to manage BPH symptoms. So how does it supposedly work? The source breaks it down into this simple 3-step process. First, it claims to go after DHT production, which it says is a major reason the prostate grows. Second, it uses ingredients aimed at calming inflammation in the prostate tissue. And third, the goal of those first 2 steps is to get to a better outcome: improved urinary function and flow. Simple as that. All right, so here's the million-dollar question. What does the source actually offer to back all this up? This last section is all about the user experiences, the results they claim you can get, and the practical how-to for using the product. To put a human face on these supposed benefits, the source includes testimonials. Take this one from a user named John. He's talking directly about one of the most frustrating symptoms of BPH, that nighttime waking, and he's claiming he got significant relief after 3 months. The document also lays out this sort of general timeline of what someone might expect. It suggests you could see some initial changes in just a couple of weeks, with more significant improvements building up over 3 months. Of course, the source is also careful to mention that these are just typical results and everyone's experience will be different. And what about actually using it? The guidelines are pretty straightforward. The source suggests a specific dose and really stresses that the supplement works best when it's part of that healthy lifestyle we talked about earlier. But the most important part, and they make a big deal of this, is that you should always talk to a doctor before you start taking anything new. And just to hammer that point home, the document even includes this direct quote from the American Urological Association. It's a really powerful way to say, hey, while supplements and lifestyle are part of the picture, nothing replaces professional medical advice, conversations about screenings, and having a doctor in your corner. It's absolutely critical. And that brings us to the end of our breakdown. And it leaves us with a really important question to think about. When it comes to your own health, how do you find that balance between a product's claims, established medical advice from your doctor, and your own personal experience? It's all about weighing all the different pieces of the puzzle to make the best choice for you.